My name is Anuj Malhotra, and I am the Director of the Division of Pain Management here at HSS. I see patients with all sorts of pain management issues, most commonly spine, and so cervical and lumbar issues, sciatica, neck pain, anything from acute strains, which are pretty short-term, to longer-term pain that has been difficult to manage. Very commonly, I'll see patients who have a newly herniated disc, which can be an acute pain issue, but still comes through chronic pain because we often treat these things. And the goal is actually not to make this a chronic treatment over time. It's actually to diagnose and see if we can get it to go away. Complex regional pain syndrome is a chronic pain condition that develops after an often minor injury to the arms or legs. And oftentimes it's misdiagnosed or missed entirely because it doesn't follow a direct anatomic path. So people look for an injury, x-rays, MRIs, things like that, but the patient isn't getting better. There's nothing to suggest what's happening, and the patient often gets misdiagnosed as having it in their head. But it's not in their head. There's a defined set of criteria that we can use to diagnose this condition, and then once it's diagnosed, like any other chronic pain condition, there are specific treatments that can be geared towards it. The focus of my practice is primarily interventional, the whole idea being if we can get a good diagnosis, then we can focus our treatment in. And so that can be interventional, that can be physical therapy, that can be medications, but if you're not targeting the right thing, you're not going to see the right result. I try to look at the patient as a whole. And patients are going to have different responses to the same problem. And so what we look for is what are their goals? What are they trying to get back to? I think that's where you start. The second thing is you have to look at all of it. So it's not just looking at a scan, it's not just looking at an exam, and it's not just looking at a history. You take all of that together, and that usually will clue you in the right direction. Once you have an idea there, a discussion with the patient can establish what their preference is for treatment, because they're often conservative, moderate, and aggressive approaches. And really it's about time frame and what's going to work best for that patient. As the Director of Pain Management, I have oversight of our outpatient activities as well as our inpatient activities and our perioperative screening. We really find that it's important to catch and treat patients at all levels of their interactions at the hospital. Sometimes that will be before a surgery, sometimes it will be after a surgery, and sometimes it will be instead of a surgery. And so being able to coordinate all of that makes this a much better experience for everyone involved. It's very gratifying to see success in a patient. The best thing I can hear is when a patient's been able to return to a lifelong goal or even a short-term goal that they didn't think they would achieve. Oftentimes in the message, whether it's a phone call, whether it's a follow-up visit, or whether it's a message on My HSS, it's so clear how much of a difference this has made for them, and I'm proud to be part of that.